Hi, it's Dr. Elisha Van Dusen at New Hope Chiropractic. A lot of people ask me, why does my neck hurt so much even though I got in a car accident with a fairly minor impact? There wasn't much damage to my car, and yet my neck really hurts. Well, whiplash pain can be much different from other types of injuries. When a car accident is severe, the pain will come on right away. If the injury produces a mild or moderate sprain, then sometimes it takes a few days for the pain and inflammation to reach its maximum extent. So you have delayed onset pain. Sometimes it is stiffness that's the prominent symptom, and the patient who's been involved in a car accident notices this in the first few weeks after the accident. A delay in pain is often seen in low-speed collisions where typically there's very little damage to the vehicles. There are a lot of factors that determine the extent of injury following a low-speed whiplash, though. One of these is that the neck posture is off prior to impact. Was the head turned to the side, or was it flexed to the side? This can occur if the patient was looking at the rear view mirror during the collision. Low-speed collisions can occur in parking lots, and if you're turned to see if a space is clear behind you or next to you, this can make a simple trauma result in a significant injury because your neck is turned. Besides the position of the patient prior to the collision, I've often found too that the speed and amount of vehicle damage are sometimes good criteria for the severity of the trauma. However, it may not be in many cases true because of crumple zones too. Cars are built with crumple zones these days, and these are areas that are crushed during the collision and absorb the energy of the impact. In some low-speed collisions, there is less crumple and more of the force is transmitted to the occupants. This is just one reason why vehicle damage won't always equate with soft tissue damage. Another factor in whiplash injuries is whether the headrest was properly positioned. A proper headrest should be close to the back of the head, and its high point should be slightly above the top of the head. The reason for the high position is that in a rear-end collision, the person who's being hit will rise slightly with the impact. They'll be lifted a little bit. And if the headrest is too low, then the neck will bend around it like a fulcrum, causing even more injury. So it can be a bad thing. The same thing happens if the seat is reclined too far back and the head whips backward before hitting the headrest. Because symptoms can come on slowly and minor vehicle damage is not a good indicator of injury, a thorough examination is definitely required. So it's important to be checked by a competent chiropractor after any collision, after any accident, and we do that on a regular basis with our patients who've been involved in a motor vehicle injury. And if you have been, or you know somebody who has been, I strongly suggest that you get them checked, and we're always available to do a free consultation and check to see if chiropractic is right for you. And as always, check out our website, newhopechiropractic.com, and have a healthy day.